The NHS is one of the safest places in the world to give birth, and we have some of the best maternity services anywhere in the world. And we want all our maternity services to be as good as the best. And so we're pleased to be part of the NHS England Transforming Care Programme, which is going to transform maternity services to really raise standards and make sure that women and babies get the best possible care. So as part of that, we have a number of things that are underway. We have Health Education England have developed a catalogue of maternity training, and this is to support midwives and obstetricians to raise standards of care through different kinds of training, but particularly through leadership training and thinking about how to work together so that they can learn together, because learning together and working together are really important sides of the same coin. The Secretary of State and the government have launched a programme, an ambition to reduce the number of adverse outcomes by 2030, so that we'll have 50% fewer maternal deaths, 50% fewer stillbirths, 50% fewer injuries to babies, 50% adverse outcomes overall. And that's very, very challenging ambition. And it means that we have to work across the whole of the maternity pathway from before conception all the way through and until after the baby is born. So really important that the multidisciplinary team consists of not just midwives, not just obstetricians, but all of the different practitioners who come together to support women and families when they're having a baby. Another thing that's really important is the lessons that we can learn when things don't go so well, when there have been problems. And the Department of Health has commissioned a standardised perinatal mortality tool. And this is going to be critical for supporting learning, because one of the things that it will do is to standardise the way that we capture information about any stillbirth and learn from the outcomes. The important thing is to share those outcomes and change practice as a result. We're also very keen to promote the stillbirths, the care bundle, the NHS England care bundle to reduce stillbirths. And that will be focused very much on reducing smoking in pregnancy. It's one of the key things that you can do to improve an outcome is to stop smoking. And we need to help women who are struggling to give up smoking. We need to help them with that. It also has support around fetal monitoring, understanding fetal movements, helping the woman to understand fetal movements. So there are a number of things that come together in that package, which, if adopted in maternity services everywhere, will really help reduce stillbirths. So we're really looking forward to supporting that. In Better Births, there was a recommendation that we also consider rapid redress and resolution, so that families where there is a negative outcome don't have to wait so long to get resolution of that problem, to know what the outcome is, how they're going to be supported, to work really quickly, to do something, to put a good package of care in place to support the family. And that's something else that we're considering at the moment. So by working at national level and local level together, we can improve outcomes for mothers and babies. But we can only do it by working together with those people who understand how to do this on the front line. They're the people who really understand how to make a difference. And the other really essential part of making a difference is listening to what women are saying about their experiences and making sure that we take them into account and that we use them very actively to improve services.
My name is Bill Irish. I'm the postgraduate dean at Cambridge, working in health education east of England. My role in this project is to support workforce transformation and education, which is an exciting role as it cuts across a number of different work streams highlighted in the report. So what our overall aim is to identify different ways of training both midwives, obstetricians, GPs, psychiatrists, paediatricians, so that they can work much more closely together and work to deliver some of the intended outcomes from Julia's report.